I know you're thinking not just about last mile health, lowercase and capital, but also about the future of work. And in terms of takeaways from this conference, it sounds like that's something you're thinking a lot about.
Hey, you know, it's really interesting. President Jim Kim from the World Bank was interviewed by Jeff Skoll here on the opening night, and President Kim made a very important point that as the world globalizes further, as we bring, say, internet connectivity, as we make it possible for people who have been marginalized to be able to see how much their living standards can improve, aspirations increase, which is a great thing. But if you don't match aspirations with opportunity, you can get some very bad things to happen in the world. In Liberia, that's the kind of dynamic that led partially to our civil war. And you can see places of extremism around the world. So one of the conversations that's happening, I know, in the technology industry is how could we, well, it's happening just in that problem, is how do we create more jobs?
Right.
And community health workers are a great way to create jobs. And what's fascinating about essentially taking health tasks that I might do as a physician that are high impact and can be taught safely and monitored and supervised to people who are 8th, 10th grade educated as community health workers are. What's exciting about that is that you're redistributing resources so that you can create more jobs, right? I mean, Liberia will have 4,000 jobs for rural, young, unemployed, previously mainly young and unemployed people who might have career paths. Now, the conversation that's happening in adjacent industries and technology is one about, is technology stealing our jobs?
Right.
And I'm not arguing that it doesn't in some ways. In this situation, the revolution that's happened in the last 50 years in handheld test kits to test for malaria, so you can do some of that now in the home in an off-grid, off-road, off-network site by a community member who's been trained as a health worker. It's more possible now because a microscope's not just in a hospital. You don't have to use just a microscope in a hospital to make that diagnosis. You're seeing some same things happen in communication technology, the advent of smartphones and the ability of that to help monitor data. Each of our community health workers has a smartphone. That's made it more possible for us to track supply chains. It's made it more possible to provide decision support to a community health worker in making a decision on whether a patient needs one treatment or another. I see that only increasing. And I think if we're smart to understand that the humanity needs technology, but technology needs humanity just as much. And here you have a group of humans. Million community health workers are needed across rural Africa alone. We know that cost about $2.2 billion a year. There's been a report released a couple of years ago. You imagine if we could create those jobs and technology could be an assistant to that. That would be new employment that leads to greater health care. And I'm very excited about the possibility of doubling down on that.
Absolutely.
Could we develop career pathways for these workers?